All right, welcome to The Explainer. Today we are jumping right in to the chronic complications of diabetes, but we're going to do it with a really specific goal, to build a practical, high-impact toolkit just for you, the pharmacist, so you can counsel patients and really empower them to prevent some of these serious outcomes.
So let's start with the stakes, because they are incredibly high. $15 billion. That's the estimated annual cost of diabetes to the Canadian healthcare system. And here's the thing you really need to know. The vast majority of this cost is driven by the very complications we're about to talk about, and so many of them are preventable.
Okay, so here's our game plan. First, we're going to hit the why, the context you need for your counseling. Then we'll get into the nitty-gritty of microvascular issues in the eyes and kidneys, and then the macrovascular stuff impacting the heart and circulation. And we'll wrap it all up with two super practical toolkits, one for key medications that have protective benefits, and a can't-miss section on sick day management. So let's talk about framing. This is huge, right? It's not about using scare tactics with our patients. It's about shifting the whole conversation to prevention. Because as you know, uncontrolled diabetes is the #1 cause of several really severe, life-altering conditions in Canada.
You know what's so powerful about this slide is that every single one of these points isn't just a scary statistic. It's a doorway. It's an opening for a real conversation where you, at the pharmacy counter, can literally change someone's future. This is where our work gets really meaningful. Okay, so from the big picture, let's zoom in a bit. We're talking microvascular complications. These are the tiny, delicate blood vessels in the eyes and kidneys, where damage can start silently long before the patient feels anything. And that's exactly why screening is just non-negotiable.
And this is just brilliant because it gives us a super simple, consistent message we can deliver. For your patients with type 2 diabetes, screening for both eyes and kidneys starts now, from day 1 of diagnosis. For type 1, the countdown starts. They get a 5-year window after diagnosis. It's a clear, simple rule that's easy for anyone to remember.
So, for eye health, here's the key takeaway you need to hammer home. Those annual exams are crucial, even if their vision feels totally fine. Damage happens way before symptoms show up, and catching it early is everything. You want to reinforce those twin goals, A1C and blood pressure control, and make sure they know to call their doctor right away if they notice any little change in their vision. And for kidney health, you can totally demystify those yearly tests. Just tell them it's a simple blood and urine checkup to see how the kidneys are holding up. And here's where you can really connect with them. You can say something like, hey, you know this blood pressure pill? It's not just for your blood pressure. Think of it like a bodyguard for your kidneys. How powerful is that? Same deal with SGLT2 inhibitors. They do more than just lower sugar, they actively protect the kidneys.
All right, let's shift gears to the really big stuff, macrovascular complications. Honestly, this is the main event. Cardiovascular disease is, unfortunately, the #1 killer for people with diabetes. We're talking about protecting the whole system, the heart, the blood vessels, the nerves, all of it.
And this is your new best friend for counseling. You can literally present this as a 4-point checklist for keeping their heart and pipes healthy. It makes it so clear that it's not just about one number. It's about managing A1C, blood pressure, cholesterol, and lifestyle. It's the whole package. And if you ever struggle with how to get that urgency across without just sounding scary, this quote is pure gold. Explaining that diabetes can effectively add 10 to 15 years onto their heart's age? Wow, that really lands. It perfectly explains why those 4 pillars we just talked about are so critical.
This is where vascular protection gets super personal. You've got to connect the dots for them between poor circulation, nerve damage, and their feet. You can explain that since they might not feel a tiny pebble in their shoe or a small cut, doing a daily foot check is their personal security system. It has to become a daily habit, no different than brushing their teeth.
Okay, now for the fun stuff, the meds. The conversation we're having with patients is totally changed, right? It's not just about, let's get your sugar down anymore. Now it's about picking the right drug to protect the right organ. And that is a powerful story to tell.
Think of this table as your quick reference guide. For an SGLT2 inhibitor, you say, this is great for your heart and kidneys, but we got to watch for dehydration, and super important, you stop taking it when you get sick. For GLP-1 agonists, awesome for your heart, but hey, you might feel a little nauseous at first. It usually gets better, I promise. And for ACEs and ARBs, fantastic kidney protection, but let me know if you get a nagging dry cough. And just like those other ones, we hold it when you're sick.
Okay, let's add a layer of complexity. What if your patient also has heart failure? This slide lays it out perfectly.
SGLT2 inhibitors are the heroes here. They are proven to keep people out of the hospital. Metformin is still your foundation. But on the flip side, you've got to be careful. TZDs? Nope, off the table. Big risk of fluid retention. Saxagliptin? We got to be cautious there. This is where a pharmacist review is so crucial.
All right, last section. And I've got to say, this might be one of the most important practical things you can teach a patient. This is all about keeping them safe when they get a simple stomach bug or the flu.
So you can literally just ask them this question. Hey, if you get sick, vomiting, can't keep anything down, do you know which of your meds you should stop taking for a day or two? And I guarantee most of them will have no idea. This is such a critical teaching moment that can prevent serious harm, like an acute kidney injury.
And boom, here's the answer. The sad man's mnemonic. Seriously, this thing is a lifesaver. It's easy. It's memorable. It's everything you need to teach them which drugs can cause trouble when they're dehydrated. This is just a fantastic tool.
So, how do you put this into practice? It's a simple 4-step plan. 1. Look at their med list. Find the sad man's drugs. 2. And this is key. Give them a written list. Don't just tell them. Show them. Write down lisinopril, metformin, whatever it is. 3. Be super clear. Stop these only when you're sick. Start them again as soon as you're better. And 4. Remind them to check their sugars more often, because illness can make them go haywire.
So yeah, this really brings it all home, doesn't it? We started with that huge $15 billion number, and this quote just nails why what we do is so vital. All these little counseling tips, they're not little at all. They are direct hits on the root cause of all that cost and all that suffering.
So look, we've just gone through a whole toolkit of counseling pearls that are backed by evidence. But you know, they're just ideas on a screen until you use them. The real magic happens in those one-on-one conversations at the counter. That's our superpower as pharmacists. So the only real question is, which patient are you going to share one of these with today?